हेलो। हाँ बोलो। ऐसे हाँ, एक्चुअली कल तो फिर वो न्यू ईयर के उसमें सेलिब्रेशन में थे ना। अभी मैं आपको अभी मेरी 12 बजे से क्लास है, उसके बाद बात करता हूँ आपसे। मैं अभी तो क्लास में सामने बैठा हूँ मैं। तो तुम एक काम करना, मैं कार्तिक से बात कर लूंगा 12 बजे के बाद। तुम मुझसे पूछ लेना फिर, हाँ? वो बता देगा आपको, हाँ?
हाँ, डॉक्टर राजवीर। डॉक्टर राजवीर
દાખલ થવાશે કે પરિવાર આવશે ત્યારે
કેટલા દિવસ રહેવું પડે દાખલ થવા?
એ તો આમ તો 7 થી 10 દિવસ થાય, બરાબર? દવા ગોળી કરીએ તો એક તો ઓપરેશન કરીએ છે એટલે પછી એટલા દિવસ તો થવાના જ છે. એટલે કેવું છે કે સામે તમને રાખીએ તો ફેર પડે અને ઘરે તમે કાળજી રાખો ના રાખો એ વસ્તુ અલગ પડી. કેટલા ટાઈમ પહેલા કરાવ્યું તમારું ઓપરેશન?
हाँ डॉक्टर साहब
છ મહિના.
અને તે કાતપુરા કરાયું હતું અમારો ભાઈબંધ છે ને એ કમિટીમાં છે તે તો સવાર પર મોજે નથી આપતું કારણ કે તે પેલા તેના વધારે પેશન્ટ આવે છે ને કોરોના
सर इनको अगर कैटरेक्ट करना है तो कितने दिन में एडमिशन भेज सकते हैं?
8 दिन ठीक हो करेंगे नहीं तो एक दो दिन हो जाएगा फिर तो 2 दिन और रुक जाएंगे बस
એના સિવાય બીજી કોઈ તકલીફ ખરી? અને આ બધું ચાકુ દેખાવાનું કેટલા વખતથી ચાલુ થયું છે?
આ ઓપરેશન કર્યા પછી પહેલા તો કમ્પ્લીટ
એટલે 6 મહિના થયા એને.
क्या
जो माइक बंद है आपका माइक बंद है
भाई बंद रखो अच्छा अरे लो ये बंद कर
कर दिए मैम। अब ठीक है मैम, अब आ रही है बस। हाँ जी, अच्छा जी मैम, श्योर मैम, ठीक है, थैंक यू मैम।
Good morning, everyone. I, Sheetal Oza, fourth year student of Parul. On PIAR, Parul University, Gujarat. First of all, I would like to welcome our guest speaker, Dr. Rajbir, Associated Professor and HOD, Department of Shalakya Tantra, Dr. Sarvapalli Radhakrishnan, Rajasthan Ayurved University, Jodhpur. Let's have a brief introduction about Sir. Sir has total 17 years of the experience in clinical and academic field of Shalakya Tantra. During this year, Sir has done a various presentations and publications of the scientific papers in national and international journals and reviewed the numerous research papers and articles for the various international journals as a medical science expert. Sir has also delivered more than 100 online video lectures during lockdown period. So I heartily welcoming you, sir. I also welcome our respected principal, sir, Dr. B.G. Kulkarni, sir, our HOD, Dr. O.P. Dave, sir, in this webinar. Now, without wasting much time, I would like to hand over the screen to our guest speaker, Dr. Rajbir Singh. Students, if have any doubt, can paste the question in chat box. Thank you. Over to you, Dr. Rajbir, sir.
Good morning, everybody, and happy New Year to all of you. First of all, I want to thank my guru, officer, for giving me such an opportunity to present the lecture. Next, I want to thank principal sir of the university, and I welcome all the students who have joined Power University as well as of mine. So I'm grateful to all of you. Director and Principal sir, please give me permission to start the lecture. Pardon? Am I audible to you? Can you hear me? Is my voice clear?
Sir, you are audible. Sir, you just.
Okay.
Yes, sir, your voice is also clear. Sir, you can start your PPT. You can minimize me tab and start your PPT, sir.
I have to minimize this, okay? From no?
Yes, sir.
Okay.
Yes, sir. And sir, now you can share it.
एक मिनट ओके
Yes.
स्टॉप शेयरिंग करना हेलो
नहीं सर नो
आ
नो
गया
सर
मैम
जस्ट ओपन योर यस सर हो गया
हो गया मैम
स्लाइड शो कर दीजिए
हो गया मैम हाँ जी श्योर
यस सर
तो
अभी आप इसको स्लाइड
pardon can you see the screen
यस सर यू कैन
okay my voice is clear hello actually there is some problem
yes
with
sir
the
yes sir clear
side but whether my voice is clear or not hello
yes we can
एक मिनट क्लियर आ रही है क्या वहां पे? हाँ, वहां से कट रही है आवाज, तो थोड़ी सी प्रॉब्लम है, तो मैं तो अपना लेक्चर शुरू करता हूँ फिर, है ना? ओके, ठीक है, थैंक यू मैम। ठीक है, थैंक यू मैम। Dr. Pudike sir, as well as from Prince, going to start my lecture. So welcome to all and happy new year. So myself, Dr. Singh, as a introduced to you by student and Dr. Aruhi.
Excuse me.
So coming.
Yes, Rajbir sir, our principal sir has joined the meeting. He would like to. Yes,
The
sir.
lecture because
He would like to.
already sometime. Okay, ma'am. So I stop sharing, ma'am. Pardon? Hello? Ma'am, I am going to call you because you are not available.
Hello?
Yes, sir, you are.
Arohi? Dr. Arohi?
डॉक्टर आरोही जी, हेलो। डॉक्टर साहब, तो अभी इसको स्टॉप शेयरिंग करने की जरूरत तो नहीं है ना? बस उनको मैं, हाँ जी, हाँ जी, परमिशन ले लेता हूँ। जी 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 मैम, हाँ जी। So kindly permit me to begin the lecture. May I be, sir? Hello? 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 Hello?
Hello, ji, sir. Sir, you are audible.
Can I begin the lecture? I'm asking for permission from
Yes, sir.
principal
Yes.
sir as well as from the sir. So can I begin the
Yes, sir.
lecture?
Principal sir has joined.
Okay, actually, I can't see them. Anyway, I welcome to him for joining my lecture. So my topic, migraine. So let me begin the lecture. So first, uh, I have to introduce the migraine. It is derived from migraine
Dr.
period
Arohi?
is derived
Ji, sir.
Am I audible?
from.
Yes, sir, you are audible. Actually, Rajbir sir
Session has
has
started.
started his lecture. Yes, sir. Yes, sir. Session
Great
has been
word.
started, sir.
Okay, please carry on.
That is
Dr.
great. You are
Rajbir
having
Singh, Namaskar. I am Dr. Kulkarni.
meaning and meanings. Yes, sir, you are. Good morning, sir.
Good morning.
Thank you, sir. I know, sir, ma'am told me that principal sir Kulkarni will join shortly. Actually, there is some internet problem in whole university. So sometimes has been wasted.
Hello.
But still, I want to ask for your permission to start. I can hear you, sir, clearly. Hello.
Hello, Rajbir Singh. Namaskar. Some problem.
Am I audible to you, sir? Hello, sir.
Yes, sir, you are audible. Sir, actually, I guess you have some network. Yes, sir. I guess you have some network issues, sir. Actually, you are audible to us, but our voice is not reaching to you.
Yes, sir.
But we
May I start, sir?
can hear.
First of all, I want to introduce. Okay, ma'am. Thank you. Introduction of migraine. No, now it is clear.
Yes, sir.
It is clear. Okay. Anyway, your voice is not clear. I can hear you well now. So my from Greek word, meaning heart, and cranium means skull. So it is a chronic neurological disorder characterized by moderate severe headache and nausea. The typical migraine attack headache is unilateral, which means affecting only one half of the head. And pulsing in nature to 70 problem nowadays. That's why I've chosen this topic, the topic migraine. If the time view of the migraine, that is Artha, or otherwise, if provided me another chance by principal sir and the sir. To its classification, migraine is divided into three types. First is migraine without aura, second is migraine with aura, and third is basilar type migraine. So aura means visual disturbance. So migraine without aura is also not accompanied by an aura, meaning visual disturbance. It is not accompanied by aura. Migraine that without aura or common migraine. Second is migraine with aura. Usually involves migraine headaches accompanied by an aura. So in this case, visual disturbance is present. Less commonly, an aura can occur without a headache or with non-migraine headache. So aura is not necessary to be accompanied by migraine headache only. It can occur without migraine or with migraine. So this is a phenomenon of visual disturbance related to migraine as well as other types of headaches. A third form is vascular type migraine. It is the most severe form of migraine where headache and aura are accompanied by difficulty in speaking, vertigo, ringing in ears, like roaring, soaring, swishing, rustling, clicking, meaning tinnitus, or a number of other brainstem related symptoms. So brainstem related symptoms are present, but not motor weakness is there. Then coming to its clinical features, migraines typically present with recurrent severe headache associated with autonomic symptoms. So autonomic symptoms are those symptoms which are not controlled within by our body or our which are under not our control. So migraine headache is associated with autonomic symptoms. Then aura, which is visual disturbance, is present in small percentage of people. Not all the migraine patients suffer aura. The severity of pain, that is duration and frequency of attack, is variable. And if a migraine lasting more than 72 hours, it is known as migraine status migrainous. So further, the symptoms of clinical facial can be divided into four possible phases to a migraine attack. Not all the phases are necessarily experienced by every patient. Additionally, the facial experience and the symptoms experienced during them can vary from one migraine attack to another in the same person. So these symptoms will vary or can vary in one same the patient in the same patient in different time of attack of migraine. For those four stages are the prodrome, the aura, the pain phase, and the postdrome. The first, the prodrome, which occurs early hours or days before the headache. So, a person or patient starts feeling that he will have a migraine attack in few days or hours. So that is known as prodrome stage, then aura. It immediately precedes the headache. So visual disturbance is present, precedes the headache. Then the actual phase is pain phase, in which headache occurs. Then now fourth stage is the postdrome. As the effects of migraine may persist for some days after the main headache has ended. So in this case, still the symptoms may be persist for some times. So these are the four possible phases of migraine attack. Then its causes. The most important thing here to explain here is that the exact cause of migraine is still unknown, but certain factors are considered to be responsible for migraine attack, like triggering factors, then vascular. In the vascular, the serotonin, which has also known as happy hormone, may be related with migraine attack. Then second is neural theory, and a third one is unifying theory. So these are the these are the causes, or the you can say possible causes, no? Because exact causes of migraine is not known. So first, coming to triggers, it may be induced by triggers. The triggers may be stress, hunger, fatigue, menstruation, and hormonal influences. So next, coming to vascular, aura, that is visual disturbance, coincides with constriction of blood vessels in the brain, starting in the occipital lobe. The reduced blood flow from this area triggers the aura, as the visual cortex is located in the occipital area. So the reduced blood flow from visual cortex is responsible for visual disturbance, that is aura. When the constriction of blood vessels in the brain stops and aura subsides, the blood vessels of the scalp dilate. So when blood vessels constriction stops and also aura subsides, that will lead to dilatation of the blood vessels of the scalp. The walls of these blood vessels become permeable and some fluid leaks out. This leakage is recognized by pain receptors in the blood vessels of surrounding tissue. So This fluid is responsible for this fluid leakage is responsible for pain receptor to recognize it. So, in this response, the body supplies the areas with the chemicals which cause inflammation. Such example of such a chemical is substance P. So, with each heartbeat, blood passes through this sensitive area causing a throb of pain. So, with each heartbeat, throb of pain occurs. Although cerebral vasodilation can trigger migraine attacks, but the thing is to be noted is that blood vessels return to their normal size more than an hour before the migraine attacks occur. So blood vessels come to their normal size an hour before the attack, actual attack. So another phenomenon that is serotonin, which is also known as happy hormone. So the low serotonin levels in the brain may cause constriction and dilatation of the blood vessel, thus triggers the migraine. So here, the happy hormones low levels may also cause migraine. Then coming to neural phenomenon, migraine becomes when certain nerves or an area in the brainstem is irritated. So it is irritated. Nerves are irritated in the brainstem. As I told earlier, as a result of irritation, release of chemical occur, which release of chemicals occur. Further irritation of nerves and blood vessels is caused by these chemicals resulting into pain. So these cause irritation and later pain. Substance P, which is 11 amino acids, is a type for sending additional pain signals to the brain. Thus, increment or increase of pain occurs with this substance P, which is released. So this was neural phenomenon. The most accepted theory is unifying theory. That is, both vascular and neural factors are responsible for causing the migraine. Stress triggers changes in the brain. So this is a trigger factor. These changes cause serotonin and or histamine to be released. So these substances are released, chemicals are released, and blood vessels constrict and dilate. Chemicals which are irritating in nature, like substance P, which irritate nerves and blood vessels, causing neurogenic inflammation and pain. So these are the combined factors, both vascular and neural, for the cause of migraine attack. Then coming to next specificity of migraine is pathophysiology. If both vascular and neurogenic aspects of migraine are taken into consideration, it has been noticed that both of these mechanisms for migraine exist and are reported. So both factors which are included in unifying theory are important for existence of migraine. Then our next heading or specificity is diagnosis. The diagnosis of migraine without aura, according to the International Headache Society, can be made according to 54321 criteria. So the explanation for this criteria is 5 means that 5 or more attacks, or in case of with aura, only 2 attacks are sufficient for diagnosis. Then attack lasts for 4 to 3 days 4 hours to 3 days in duration. So 4 3 criteria here has been explained. Then for two, that stands for two or more of the following: unilateral, that is affecting half the head, then pulsating, then moderate or severe pain intensity, aggravation by or causing avoidance of routine physical activity. The meaning of this sentence is that migraine attack can be aggravated or maybe caused either by working or routine works, doing routine works, or even avoidance of them will lead to migraine attack. So, so two or more of the following factors are responsible for it. Then one or more of the following: nausea and or vomiting. Maybe one of the following factors may phenomenon to remember or pounding. P stands for pulsating, OU stands for dual, U stands for unilateral, and stands for disabling. So this pounding mnemonic can also help to diagnose migraine. If 4 of the 5 criteria are met, then the positive likelihood ratio for diagnosing migraine is helpful. Then coming to management, there are 3 main aspects of treatment of migraine. That is trigger avoidance, acute symptomatic control, pharmacological prevention. Then coming to treatment part, first we consider or discuss the prophylactic measures. In the prophylactic measures, taking preventive drugs, election goes on the stage and take exercise and avoidance of food. Coming to preventing medicine severity or headaches. So, in the ratio of 50%. Then coming to available to treat the migraine include beta blockers. As we all know, beta blockers are parasympathetic drugs such as propranolol, atenolol, and metoprolol. Then calcium channel blockers, which are used for hypertension to control the hypertension. Examples are amlodipine, fluoronazine, and verapamil. Then anticonvulsants are also given to treat the treat or prevent the migraine, such as sodium valproate, divalproex, gabapentin, and topiramate, and tricyclic antidepressants. So these are antidepressants which are used to treat the attack of migraine. Then analgesics are given, which include non-steroidal anti-inflammatory drugs, like uh, brufen aspirin. Even by itself, caffeine can be useful during an attack, in spite of the fact that in general migraine sufferers are advised to limit their caffeine intake. But sometimes taking coffee, tea, or will help the migraine patients for symptomatic relief of migraine. Then coming to the most popular drugs which are given today as triptans. Triptans such as sumatriptan are effective for both pain and nausea in up to 75% of people. Then ergotamines, these are older medications prescribed for migraines, but still, as these are less expensive than triptans, and or also like dihydroergotamine is also found to be very effective in certain patients. So some uh, physicians or surgeons uh, prefer to give ergotamine or prescribe ergotamines than triptans. Then coming to steroids, a single dose of intravenous dexamethasone added to standard treatment migraine attack reduces frequency of headache recurrence in the following 72 hours. So intravenous injection of dexamethasone is also helpful. Then surgical treatment. The results of surgery are outstanding once a positive diagnosis has been made. They are not only provide permanent relief but also relief from associated symptoms. So surgery is successful after diagnosis. The procedure includes surgical cauterization, removal of muscles or nerves in the areas of trigger sites. So first considering surgical cauterization, in this superficial blood vessels of a scalp, that is terminal branches of external carotid artery, if these are found to be source of pain, their surgical cauterization is done. The removal of muscles or nerves in the areas of trigger sites provides good results, but the limit is that it is effective in patients who have benefited or will benefit from Botox injections in specific areas. So only those persons will be or patients will be benefited from removal of muscles or nerves in the trigger sites. So this was modern aspect of the migraine. If principals and the vessel and coordinator ma'am allows me, then I may take the uh, Ayurvedic point of view of it also today. And if you think so that there is more time, then I summarize my topic.
Yes, sir. I guess we have to summarize the topic now as we are running short of the time. Uh, yes, sir. Students,
Okay,
the task
ma'am. Sure.
on.
First, I want to ask students to ask me any question. If they have any query, they can ask me.
Sir, I think we will have your Ayurvedic portion for second time. Then we will have a question and answer.
Sure, ma'am.
Yes, sir. Uh,
Sure, ma'am. That's very good, ma'am. Very nice.
Actually,
Because
yes, students are also
we can see
to ask
that.
questions, but
Okay, ma'am.
But today I think we have
Okay,
some
so
network issues. So we may have question and answer session,
okay,
sir. After you finish, I will
okay.
question.
So okay, ma'am. So may I stop sharing the screen?
Yes,
Hello?
sir. You can stop share. Yes, sir.
Then I can see people, like there is and you and principal, sir.
Yes, sir. David sir will be having word with you, sir. After you stop the screen sharing.
Okay.
Dr. Rajbir, I am
I
here
will
with
stop
you. Huh?
screen sharing. Can you see hello? Hello?
हाँ जी दावे सर.
Hello. हाँ, Dr. Rajbir ji.
Yes,
Please
sir.
continue. Please continue. So nice.
Namaskar, sir.
Very nice.
Sir,
You have presented very nicely.
thank you, sir. Thanks a lot, sir. It is blessing of my
Carry on.
teacher and guru of my teachers, Dr. Dave, sir.
Thank you, Dr. Rajbir. Please continue. So nicely. You presented
Sir,
very nicely.
thank you, sir. My pleasure, sir, for your compliments, sir.
Dr.
So
Arohi.
I want to thank you, Principal, sir, for providing me such an opportunity to present the lecture. Then to my teacher, Dr. Om Prakash Dave, sir, coordinator, ma'am, Dr. Arohi, Assistant Professor, Department of Shalakya of University. And I also want to thank university management, all the teachers, the students, to hear me, give me a chance for presenting the lecture. So this is my side. So next, oral sir, principal sir, Davi sir, and madam.
Thank you,
Yes, sir.
Dr. Arohi.
Thank you, sir.
Dr. Arohi.
Yes.
Can we give the
Yes,
voter
sir.
Pardon,
thanks?
sir? Hanji, sir? Pardon, sir?
Yes, sir.
Dr. Rajbir.
Yes.
Actually, sir, there is a problem.
Thank you,
Sir,
Dr. Rajbir.
sir, voice problem is.
Thank you,
Yes,
Dr.
sir.
Rajbir. Thank you very much, Dr. Rajbir, for your nice
Okay, sir, thank you.
Again, I am
Okay,
thankful.
I appreciate you, sir.
Again, I am thankful to our respective
Thank you, sir.
principal, sir, our management of
Yes.
our university, all the students, our students, Manthan and his group, for cooperating the presentation. Again, I am thankful to our Dr. Arohi, the in charge of Shalakya Tantra department, for her cooperation.
Yes,
In the
sir.
last,
He is very popular.
I bless you for your future, bright future.
Thank you, sir. Thank you very, very much. I need your blessings, sir, for whole my life.
Dr. Arohi.
जी सर.
सम अप करें कोई क्वेश्चन आंसर है. आर देयर एनी क्वेश्चंस?
सर एक्चुअली ऐसा डिसाइड किया है कि सर का नहीं सर, हम सर का एक और बार आयुर्वेदिक सेशन भी लेंगे सर. उसके बाद हम क्वेश्चन आंसर सेशन भी रखेंगे.
वेरी नाइस, वेरी
जी
नाइस.
सर.
थैंक यू.
ओके सर. Yes sir, we are ending the session now.
Thank you, sir. Thank you, ma'am. Thank you.
Yes sir, Rajbir, I will call
Okay,
you.
ma'am. Thank you.
Thank you.
Okay, ma'am. Thanks a lot. जी, ma'am.